Dave was always very active, very bright, started reading very early. I remember watching The Wizard of Oz with David when he was about 6 or 7. Everybody, all the munchkins, follow the yellow brick road, follow the yellow brick road. I realized there's that red swirl along with the gold. And David turned to me and said, "Where does the red road go?" He, from a young age, had a different way of viewing things. By 3rd grade, he was diagnosed with attention deficit, also generalized anxiety. I think things really converged for us in high school when he started to experiment with substances. Through most of his young adult years, we were in a constant state of waiting for the other shoe to drop. When the pandemic came, he was just using a lot more. And I got the literal knock on the door at 2 a.m., and it was an Oak Park policeman, and he said that David had passed away. It was at the Rosemont CTA station on the Blue Line around midnight. He was found by a CTA worker. I found out he died on car 2970. I'll always remember because he was 29 years old. And he actually had Narcan in his pocket. I decided I wanted to learn more about Narcan and preventing other deaths like David's. I've become a trainer. It's been very gratifying to be able to channel the grief into something productive.
Justin had a really round face and really round eyes. He was like the sun, just happy, smiling, but often misunderstood. As we progressed in the school setting, the anxiety started to become a little bit more evident at school as well as more at home. At that time, children with issues of anxiety and any mental health issues was extremely taboo, which was challenging. The year he went to college, he started in the fall. Many things combined created a battle that we simply lost. Working in the mental health arena is not something I thought I would have ever been doing. I think the advocacy now has shifted as I joined the Erikson Institute board. Their commitment to early childhood education and to families was a great fit.
I've known Peggy for about 9 years. She was one of the first people that I met when my boys transferred to the lab school here in Chicago. When Peggy and her family lost their son, Justin, I saw the impact on my son for weeks later after the funeral. It just really impacted me. That was really the catalyst to start the Ortis Foundation.
At Erikson, we prioritize mental wellness by design. Instead of waiting until a crisis occurs, we want to make sure that children grow in a way that fosters their mental well-being.
What's particularly important is social and emotional well-being. Everything facilitates through that little bubble. It's all within the connection, the relationship, and the context of someone who loves you.
Mental health is really belonging, feeling that you belong. As important as relationships are, they are not enough. We have to commit as a society to the well-being of each child in every family and in every community.
Sheila came to a CTA board meeting. I had read an article about her son and just thought, I gotta meet this woman. I walked up to her and introduced myself, and it's just been on ever since. We are in the transit business. We move people. We need support on the social services, on the behavioral health, on the substance. Someone overdosing on a train, it's a community event. We wanna make sure we have partners that can help us with the folks that are falling through the cracks.
No child is born with a handbook. Early intervention is really essential to get at the support that children need early on, so families can have that kind of playbook, but from the very beginning.
I think we need to collectively think about mental health like physiologic health. It needs to be like a vital sign. If you have hypertension or diabetes, mental health needs to be put in that category. It's important for us as providers to really spend some time on that.
I just recently completed the Executive Fellows program with the Erikson Institute, and that was so eye-opening. If we were to invest in early childhood and go hard, like how do we get the lawmakers, labor, philanthropy, how do we get everyone in the room and talk about these things holistically?
People need to realize that our physical health and mental health are intertwined. It's not magic, it's not mysterious. It's literally about caring for yourself, paying attention, and being able to pay attention to others. And that's that authentic connection.
I do believe we have both the responsibility and ability to change the story of youth mental health in this country. Erikson has done a tremendous job at early childhood mental wellness. It's really an ecosystem of parents and siblings, the family unit, schools, therapists, the pediatrician. We build this support system around the kid because it is a complex problem with complex solutions.
We chose to embrace it, as well as find purpose in losing our son to mental health, and in the hopes of helping other families. Even if it's to help one person, it certainly is well worth it.